One of the all too infrequent causes of back pain, especially in those who are 40, 50 and older, particularly 70 and 80 years old, is a compression fracture. This is a situation where the vertebral bone crunches down. Sometimes there's trauma where you fell off something. Sometimes as you get older, your bones are thin and they just crunch down. So if you come in and you have pain in your mid-back particularly, or pain in your low back, I can't do much about it in the neck, but if it happens in the mid-back or in the low back, sometimes on an x-ray we'll pick up that the bone is crunched down. It looks like what's called a wedge fracture. X-ray doesn't always pick it up, but a CT or an MRI are the best ways to pick it up. But it wouldn't probably be the first test we do. But if we have suspicion that you have a compression fracture, then we are going to test for that with the X-ray or the CT or the MRI. And if we find you have it, particularly on the MRI, it shows that it's a new fracture because there will be swelling in the bone, there will be edema, and we pick that up. Then we're going to talk to you about an option called kyphoplasty. Because what's happened is the bone, which should be like a square, you can see these kind of are square shape, they crunch down and they make you lean forward into kyphosis rather than standing up straight or even leaning back. And so what we try to do with that is we try to put cement in that bone so it doesn't keep crunching down, crunching down, crunching down, crunching down. So if you have a new fracture, it's one, maybe two, maybe even three bones, we talk to you about a kyphoplasty. And so what happens in a kyphoplasty is we find the bone that's fractured, we bring you into our procedure room, we have you lie down and give you some numbing medication, and we find the bone and we place the needle and we push the needle through the little foot there called the pedicle, and we put it right into the vertebral body. That part doesn't seem to bother the patient as much. And then we blow up a balloon inside that fractured spot, and while that's blown up and sitting there for a few minutes, we mix up cement. Now it's not like concrete cement. It's the kind of cement called methyl methacrylate, which is used to hold in hips and knees. And so this is a well-known cement that's used in the medical field. And then we come back, we hook that up to, and we take the balloon out, and we put the cement in the bone so the bone doesn't crush down any further. So that's a procedure that's not particularly painful. It doesn't get the bone height all the way back up, but it does prevent it from going down further. And so kyphoplasty is something that can be considered if you're having mid-back pain or low back pain from a fractured vertebral body. It doesn't help if you don't have a fractured vertebral body. If it's just coming from the joints or ligaments, we wouldn't do a kyphoplasty. But if there's a fracture and it's shown to be a new fracture, a kyphoplasty would make sense for that type of a thing. So if you have those kind of questions, come in, we can chat about it, we can clarify it more from an X-ray or an MRI. Thank you.